The outbreak in West Africa is unprecedented in the history of Ebola outbreaks because it involves 3 countries at least, capital cities, multiple sources, and that will make it far more difficult to control.
It's been a growing problem with officials in Liberia, Guinea, and Sierra Leone scrambling to contain the latest outbreak of the Ebola virus. Over 500 people have died in this outbreak, with porous borders, misinformation, and stigma contributing to the spread of the disease. And joining me right now is VOA reporter Linord Moudou, who is also hosting Africa Healthchat. Thank you so much for joining me.
Thank you.
The first time we heard about this was in 1976. What makes this one so different?
This time around, what makes it different is, first of all, the way it has spread, the location, not just in one country, but quickly it spread in 3 countries. We saw it, started in Guinea, spread to Liberia and Sierra Leone very, very quickly. And also the numbers of people, the number of people that are being infected and people that are dying. As of today, we have over 700 people that are being infected with over 500 deaths, which is unprecedented. In the past, when we've seen high numbers, was in 1976 when it was first discovered. Of course, at that time, no one knew what it was, so the disease had the time to spread and make more victims. So back then, there were over 300 people that were infected and a little close to 300 deaths. And in 2000, the second biggest outbreak was in 2000 in Uganda, where you had more than 400 people that were infected and a little over 200 deaths. But this time around, it's much, much more.
And people are also concerned about the stigma that the disease carries, and people, because of that, are not coming out. Definitely.
It's not just stigma. As the Deputy Health Minister of Liberia said, Mrs. Dawn Bernice, she said that one of the challenges is the fact that there is denial, there is fear, and there is panic. So we can add to that stigma, and we can also add to that mistrust. Mistrust, why? Because some people believe, some locals believe that this is a Western-made disease. This disease was brought in by the Westerners. And also, when we talk about stigma, sometimes they think even if they recover from the disease, people will not approach them anymore, or people think that this is due to a bad omen or a juju, local belief. And so when you have denial, they don't think that it is Ebola, they don't know Ebola. You have fear because there is no treatment, because there is no vaccination, and many other reasons, so people panic.
And quickly, in 20 seconds, you can tell us that another fear is that it might spread into mass population, like in the rural areas.
Absolutely. Usually, this outbreak, Ebola outbreak, happened in rural area. This time, it went quickly to the cities, and when it goes to the cities, you see densely populated areas where people move around, and also the borders are porous in West Africa. So that's why the disease has spread quickly in 3 countries, and there is really fear that it will spread further in other countries as well.
All right, we keep an eye on that. Thank you so much for joining us.
You bet.